So why does healthcare matter? Healthcare should not be viewed simply as a government expenditure. It is an investment in the people, you and I. Healthy populations are more productive, children perform better in school if they are healthy, businesses experience fewer productivity losses, and economies become more competitive. Conversely, poor health increases poverty, reduces household incomes, and places greater pressure on public finances. The World Bank consistently identifies health and education as two pillars of human capital development. Our country cannot achieve sustainable economic growth without investing in both. Healthcare is therefore not only a social service, it is an economic strategy and a governance priority. Long short of it is this, that if you are healthy and I am healthy, then the nation is healthy and the nation grows. A sick child cannot go to school. A sick servant cannot go to work. A lactating mother who is not getting enough nutrition cannot effectively raise a family. Therefore, healthcare is the foundation. It is the unit of development of family and society. A healthy society is a healthy nation. If all of us are working, if all of us are involved in nation building, then we must be healthy. We must eat good nutritious food, and we must be able to be strong and to stand and to be able to build our country. That is why health is important. Therefore, what is the current state of Kenya's healthcare? Kenya's healthcare presents a mixed picture. On one hand, the country has expanded healthcare infrastructure, strengthened immunization programs, improved access to HIV treatment, and increased life expectancy, just like we've said earlier on. County governments have also invested in new hospitals, health centers, dialysis units, and specialized services since devolution began. You will remember, or you might have known, that healthcare is a devolved function, that it is the counties that are involved in the running of healthcare matters of their people. They build hospitals, health centers, equip these centers with equipment, and hire doctors, nurses, and other healthcare providers and healthcare workers. So as a devolved function, healthcare is a key component. Also, in the national government, healthcare also is an imperative issue. The national government runs the larger policy and the larger issues that are involved in the management of healthcare of a country. The national government is also involved in running of the largest referral hospitals in our country, for which we have a few, and I'll mention the Kenyatta University Referral and Teaching Hospital, KURTH. We also have the Kenyatta National Teaching and Referral Hospital, which is a big hospital in Central and in East and Central Africa, and we have the Moi Teaching and Referral Hospital in Eldoret. These are the imperative of the national government, but we know very well that county governments have health as a devolved function, and healthcare is devolved at that level, so that healthcare needs can be met by the devolved governments and can reach the common man at the basic level in the grassroots. Therefore, what is the other side of the mixed picture that is health? Communicable, on the other hand, demand for healthcare is changing rapidly. Kenya is experiencing what public health experts describe as a double burden of disease. Communicable diseases such as HIV and AIDS, tuberculosis, malaria, and waterborne infections remain significant public health concerns. At the same time, non-communicable diseases including cancer, diabetes, hypertension, cardiovascular disease, and kidney disease are increasing steadily. Mental health conditions are also receiving greater attention, particularly among young people, while road traffic injuries continue to place pressure on emergency and trauma services. Unlike infectious diseases, many of these conditions require lifelong treatment, specialized care, and sustained financing, placing additional demands on hospitals, healthcare workers, and insurance systems. So we are seeing a mixed picture when it comes to the management of healthcare issues. That on the one part, we've talked about life expectancy has increased, the reduction of HIV and AIDS, the reduction of cases of tuberculosis and malaria. Remember, again, I'm not a doctor, I'm just looking at the policy issues that are confronting the healthcare sector. But on this other side, as the population grows, so does the demand for quality healthcare increases. And that is why communicable diseases such as HIV and AIDS, tuberculosis and malaria, and waterborne infections remain significant public health concerns. Therefore, in short, what this is saying is that healthcare is a juggernaut. It is a gigantic leviathan system, a system that requires due regard each and every day, each and every second, and in each and every minute. A sector that requires funding, a sector that requires checking, a sector that requires at any one time, there's people concentrating in the management of healthcare in this country. Because it's a mixed pattern. You cannot deal with an healthcare issue today and say that since the numbers have reduced, then you also relax and probably ignore. But the important factor that we are seeing here is that as a mixed imperative, as a mixed issue, healthcare is a going concern in every government of the country and of the day.